Rheumatoid arthritis. Rheumatoid arthritis, also known as RA, is an autoimmune disorder in which the patient's immune system attacks the connective tissues, initially the synovial membrane, then it causes cartilage destruction and bone erosion, leading to joint swelling, stiffness, and pain. Synovial membrane is a thin protective lining of a joint that provides nutrient and blood supply to cartilage, and cartilage helps to support joints. Complications of RA include deformities of the affected joints and muscle atrophy. Both can lead to impaired ability to perform ADLs. Risk factors. RA can happen at any age, but risk increases with age, and risk is also higher for female gender and those with family history of RA. Any conditions that cause inflammation in the body, such as smoking, excessive alcohol use, obesity, periodontal disease, and infections, can trigger an autoimmune response. Diagnosis. There are several blood tests that can help diagnosing RA. For example, anti-citrullinated protein antibody, or ACPA, is an autoantibody that is highly specific for RA. Rheumatoid factors are also autoantibodies found in RA, but are less specific because they can also present in other autoimmune diseases such as lupus. Erythrocyte sedimentation rate, ESR, and C-reactive protein are inflammatory markers that indicate generalized inflammation and are not specific to RA. They are useful in monitoring the effectiveness of RA treatment. Other diagnostic tests include aspiration of synovial fluid from the affected joints and obtaining X-ray or MRI of the affected joints. Signs and symptoms. Classic signs and symptoms of RA include swollen, stiff, and painful joints that usually start in the small joints in the hands and feet and move proximally to ankles, knees, hips, elbows, and cervical spine. They are usually bilateral and symmetrical. The small joints in the fingers are most susceptible to deformity and are known as swan neck deformity and boutonniere deformity. They both affect the small joints in the fingers called distal interphalangeal, or DIP, which is the joint that is at the tip of the finger just before the nail starts, and proximal interphalangeal, or PIP, is the middle joint that is located below the DIP. So remember, DIP is at the top of the finger because it is distal to the body, and PIP is proximal, which means it is closer to the center of the body. With swan neck deformity, there is flexion at the DIP, or the distal joint, and hyperextension of the PIP, or the proximal joint, making it look like a swan with a long neck. With boutonniere deformity, it is reversed. There is flexion of the proximal joint and hyperextension of the distal joint. Another unique feature of RA is that the pain worsens with rest and relieves with movement, because movement helps to prevent stiffness of the joints. So remember this for exams. Patients with RA usually have prolonged morning joint stiffness that lasts for more than an hour after waking up in the morning. Other signs and symptoms include fatigue, anorexia, and weight loss due to systemic inflammation. Nursing interventions. There is no cure for RA, but remission or absence of signs and symptoms can be achieved. The goal of care for RA is early diagnosis and treatment to preserve joint function and to remain in remission. NSAIDs and steroids are commonly prescribed during the acute phase to reduce inflammation and relieve pain, but they are only for short-term use. In the next video, we will review disease-modifying anti-rheumatic drugs, which are the mainstay of treatment for RA. Other measures for pain control include alternate use of heat and cold therapy, taking a warm shower or bath before bed or after waking up in the morning. Encourage physical mobility, such as range of motion exercise. Low-impact exercises, such as swimming and walking, will help to preserve joint function and strengthen muscles to prevent deformity. Encourage the use of joint-protecting and adaptive devices, such as raised toilet seats, self-rising chairs, chairs with high, straight back, and splints may be applied during acute inflammation to prevent deformity. Identify safety hazards and prevent falls at home.